Dr. Courtney Beard is a clinical psychologist and an associate professor of psychology at the Department of Psychiatry at Harvard Medical School, with expertise in anxiety disorders and cognitive behavioral therapy. Dr. Beard's research tackles the lack of diversity in digital mental health intervention trials, which is a very, very important theme. And it also emphasizes upon the cultural relevance of sort of digital mental health interventions. So her talk today will present findings on the accessibility and engagement of the smartphone delivered interpretation bias intervention, HabitWorks. Dr. Beard, over to you.
Great. Thank you, John and Shruti, for inviting me. I'm really excited to get to share this recent paper that we published. Just want to disclose that the NIMH helped fund the development of the HabitWorks app and our ongoing testing of it. Also want to acknowledge and thank my amazing co-authors and consultants on this project, as well as the Community Coalition for Equity and Research over at Harvard Catalyst. They provide really helpful consultation for our ongoing work. So I direct the Care Lab at McLean Hospital, and our mission is to develop mechanism-driven and scalable interventions with and for people with anxiety. And a lot of our work focuses on a very specific mechanism referred to as interpretation bias. So for anyone who's not familiar with that specific mechanism, it's very simply the tendency to sort of automatically jump to negative or threatening conclusions when faced with an ambiguous or uncertain situation. Or on the flip side, the tendency to sort of not generate more benign or neutral interpretations of those same situations. And this mechanism has been studied for decades now. We know it's critical in anxiety and related disorders. And so we've been developing over the past many years technology-driven ways of targeting this bias that are different from how we might typically target it in therapy. So I'll start by just showing a few examples of how this bias shows up in our daily life, so you can really get a sense of how influential it can be on how people are feeling in the moment and how they respond to situations. So let's say you were out with a friend last night and you're feeling a little iffy about something you said as you were leaving. And so you might text them and say, oh, sorry about what I said, and do you want to get together again this weekend? And let's say you see those 3 dots, but then you never get a response. This happens all the time. So some people might not think much of that because they're automatically interpreting that as their friend just got really busy. They got pulled into work and they haven't responded yet. Whereas someone else might jump to the conclusion that their friend is mad at them and really start ruminating, and it impacts their entire day. Totally different example. Let's say you send your adorable children off to sleepaway summer camp for the first time, and you're not allowed to talk to them. And so the only way you know how they're doing is if they write you a letter home. And let's say it's been a week, you haven't heard anything from them. So one parent might say, oh, this is great. They're having so much fun. They're not even thinking about me, haven't had time to write to me. Whereas another parent might really worry, think something's not right, they're not okay. They might even call the camp to seek reassurance, or they might write in their letters to their kids, like, are you okay? You can come home if you want, and sort of really reinforce the idea that camp might be threatening to them. Final example, this is one that really I personally relate to, happens to me all the time. Let's say you get an email from your boss or someone who's in a senior position and they want to meet with you and there's no other context. So this is classic ambiguous situation. For me, when these things happen, my stomach drops and I'm always jumping to the catastrophic, something really bad has happened, even though most times that's not the case. So you can see just how influential having this mental habit can be. And so we've been developing the app HabitWorks over a number of years now with people with the lived experience of anxiety to address this bias. And so we started off at McLean Hospital with people attending our partial hospital program, and they co-designed the app with us. We did a pilot study there. We have since piloted it in a totally different sample of parents of anxious kids. And then more recently, the study I'll be presenting today was a pilot study in Black and Hispanic Latinx adults. So there were several reasons we wanted to pilot this specifically in Black and Latinx adults. I guess the first one that isn't even on my slide is McLean Hospital serves a primarily white population. So some of our original work did not have good representation. So that was sort of an open question on the acceptability of HabitWorks. But more broadly, we know there are many more barriers to care for Black and Latinx people. And there's fewer Black and Latinx psychologists in the US relative to the US population. Of course, everyone knows of the long wait lists. And so digital tools are really exciting because they might be able to bridge some of these gaps. However, we know that most data on digital mental health interventions comes from white women. There's very few studies that have validated these tools in specific cultural groups, and even fewer tools that have been culturally adapted. And then our final reason for conducting this study was very specific to the HabitWorks intervention itself, and any type of interpretation bias intervention. We wanted to make sure this wasn't going to actually cause distress or harm in minoritized groups. And that's because we know that, you know, the app, as I'll show you in a minute, it presents tons of just typical daily situations that might come up, like the ones I just shared with you. And we know if you are from a minoritized group, those situations might come along with thoughts of discrimination or racism, other identity-related stressors. And we know that asking people to reappraise those types of thoughts is not helpful. It's invalidating. That's not the approach, and that's not the purpose of HabitWorks, but we wanted to make sure that it wasn't bringing up situations like that and interpretations like that, and really understand how people were experiencing this intervention. So we conducted a small open trial to test the initial safety, acceptability, and engagement with the HabitWorks app, and then conducted qualitative interviews to really gain a deeper understanding of how people were experiencing it and whether it brought up thoughts about discrimination, racism, or identity-related stress. So I'll just give you a quick sort of snapshot of what the app is. This is what the dashboard looks like, where people can access all the features. They can also get a little snapshot of their progress of the week. When they first onboard to the app, they watch a couple brief videos where I'm explaining the rationale behind it and how to do the interpretation bias exercises. They are then prompted to personalize their experience. So they answer some questions about their current life circumstances, like, are they a student? Are they working? Are they a parent? They also complete some checklists about situations that they worry about. And the app uses that information to deliver ambiguous situations in the exercises that are going to be personally relevant to them. So this is the main feature of the app. It's the interpretation exercises, and this is based on the word sentence association paradigm, or the WSUP. And in this exercise, your job is to decide if the word and sentence are related. So you might see a word like breakup paired with the ambiguous situation, you and your partner have an important discussion. So in this example, breakup is the threatening interpretation of that ambiguous situation. And so we would want people to say, no, that is not related. And if they said no, they would be told they were correct and get a point. And so in a session, they would do, depending on the session, 30 to 100 of these situations. They're supposed to go very quickly, so it takes less than 5 minutes. But they're repeatedly being reinforced for rejecting threat and endorsing more benign or neutral interpretations. And then at the end of each session, they get a little summary of how they did and an encouraging GIF. And they can also track their progress over time. And then we also have a diary feature that prompts them to really think about the exercises they're doing in the app and how they're relating that to their actual life. So it prompts them to write about instances where they notice themselves jumping to a conclusion or some type of change in their thinking or behavior related to what they're doing in the app. So I don't have time to go over all the features that we've developed over the past few years, but we've spent a lot of time trying to incorporate features that will enhance engagement with the app. And the one thing we added for this specific pilot study is a library of resources, which we had not had previously. So because this app was not intended to help with identity-related stress, we wanted to make sure we had resources that addressed that in case it came up. So within the app, we added a whole library of resources related to mental health in general, finding a therapist, discrimination experiences and social support around that, as well as some social and financial resources. So the inclusion criteria for this open trial was any adult who self-identified as Black and/or Hispanic or Latinx. We only had an iPhone version available, unfortunately, at the time of this trial. We have since gotten funding and have an Android version as well. People had to endorse at least some minimal symptoms of anxiety and depression. So this is designed to be sort of targeting that mild to moderate anxiety and depression. Also had to be English speaking, so that's something to keep in mind when we're talking about acceptability in the Hispanic and Latinx sample. These were English speaking people, and no active mania or psychosis. So we ended up with 31 participants, mostly women, nice age range, well educated. So that is something to keep in mind when we're talking about generalizability. Most were from Massachusetts, but about a quarter were from other states. And it ended up being about half people identifying as Black, half as Hispanic, 10% identified as both. Okay, so these are some of the sort of benchmarks that we set for some of our outcomes. And then on the right in green is what we actually saw with the data. So in terms of safety, we didn't have any instances of clinical deterioration or any increases in suicidal ideation related to using the app or participating in the study. So no safety concerns. And for adherence, we asked people to use the app and specifically to do those exercises 3 times a week for 4 weeks. So it was a month-long intervention phase. And we were hoping to see that at least half the sample would be able to do that. And what we saw was in week 1, almost everyone was able to do 3 exercises a week. And that, of course, dropped throughout the course of the month. But even by week 4, 68% of people were doing 3 exercises a week. So we were really pleased to see that level. We also looked at people's perceptions of the credibility of HabitWorks and their expectations for improvement. This was, prior to them using it. So people thought it was moderately sort of a logical treatment before they started. But in terms of how much they expected to improve, this fell below our benchmark of 50%. And so that's one area where we have that's in need of improvement. And I think this is not specific to HabitWorks. I think this is an issue for a lot of digital tools where people don't have a lot of faith that it's going to help them. This graph is just showing adherence in a little bit of a different way. So it's the average number of exercises completed per week. And then the red line is that recommended dose of 3 per week. So you can see it does drop off over the weeks, but even by week 4, the average number is higher than our prescribed dose. So we had a lot of people doing, more than what we were asking them to do. In terms of our qualitative interviews, these were conducted by members of my team, all identified as people of color, and they were done over the phone. And these are just some of the themes that came out. So people thought the app was easy to use, intuitive, quick, efficient. They liked the notifications, the mood check-ins, the exercises. Negative feedback, there wasn't actually very much, but when there was, it centered around the exercises being tedious or repetitive. People thought it increased their awareness of their mental habits, helped them stop jumping to conclusions, and some people felt less anxious. And then when we specifically asked people, did these situations or using the app bring up thoughts about, times you've experienced discrimination or race-related distress in any way? And people overwhelmingly denied that happened. We only had 2 participants even say that some of the situations could be related to things like workplace discrimination. But they did not report that was distressing in any way and didn't feel like the app was asking them to, reappraise those types of things. So that was very reassuring. Just going to present some of the clinical outcomes. This was, not a controlled trial, so we can't say anything about efficacy, but just to show you that we did observe some large effects on their WSUP score, so their interpretations, and small to moderate improvements in anxiety and depression. So just to summarize, because I know I'm almost out of time, we met benchmarks for safety, feasibility, adherence, and acceptability, with the exception of a lower expectancy for improvement. Despite having that low expectancy for improvement, we saw high satisfaction after use. And we saw really great adherence, much better than what you would typically see with other digital mental health interventions. And despite us not specifically culturally adapting HabitWorks, we saw comparable acceptability to other culturally adapted tools. And then I'm going to move on. And so next steps. So these results were sort of encouraging, reassuring. So we now are testing HabitWorks in an ongoing RCT in the general population. We're hoping to recruit a large, diverse, and representative US sample. And with that, we hope to be able to look at acceptability and engagement and effectiveness in more specific cultural groups. We know that Black and Hispanic Latinx groups are extremely heterogeneous, and we couldn't go into that level of detail in this pilot trial. We also hope to one day culturally adapt for Spanish speakers, since we had to exclude them in this initial study. And if you want more information about HabitWorks or the WSUP, we've published many things over the years on different iterations of this intervention, so check it out or feel free to get in touch with me. And thank you.
Great. Thank you so much, Dr. Beard. I think, the study, it definitely highlights the potential of culturally adapted interventions, but, it also sets a wonderful precedent for inclusive mental health solutions, which is so important. And, just speaking of, I think there are a few related questions in the Q&A box. So it says, oftentimes apps that are well researched don't find their way into the app marketplace for those who may benefit from them to use. Are there any plans to make HabitWorks broadly available as a clinical adjunct or self-help tool?
It's a wonderful question. That would be the ultimate goal. I think it's going to depend on what we find in our ongoing RCT, because so far we have spent many years and a lot of time developing the app and doing a lot of the important co-designing qualitative work, but we don't actually have a good trial yet testing effectiveness. So once I feel that it's actually, has something to offer for sure compared to a control group, that would be our next step.
Amazing. I think we may be able to get to one more question. So I would be interested in learning your plan of cultural adaptation. As you mentioned, their anxiety may be also related to racism and discrimination. So
Wow.
how are these structural determinants of mental illness sort of incorporated into adaptation of the app?
That's a wonderful question. And this is not my area of expertise in terms of treatments and interventions and support for identity-related stress. So if we were going to incorporate that into the app, that would require a lot more development work with experts in that field, and certainly people with lived experience of the, me as a white woman. I'm the one that most of these tools have been tested on. You don't need me doing that work necessarily, but working with others. And so I would need to be relying on experts in those areas. And I think it's a really delicate thing, like I was saying when we were testing this out, because we don't want to invalidate those experiences. And so we would need to be very thoughtful about how to combine something like that into this type of intervention.
Yeah, no, that's very well put. Thank you so much, Dr. Beard. And for please everyone, please feel free to connect offline to ask more questions.